Quick question before we start. When you climbed into bed last night, did you think, even for a second, about the position your body was in? Not how many hours you slept, not whether you felt tired the next morning. I mean the actual physical posture your body held for 6, 7, 8 hours straight. Most of us never think about it. We roll into whatever spot feels comfortable, we drift off, and we assume sleep just handles itself. But there's something a lot of heart specialists and sleep researchers have been watching closely for years, and it almost never comes up in a normal doctor's visit. The way you position your body at night can either protect your heart and brain, or it can quietly work against them. And if you're past 60, that difference is bigger than most people assume. This isn't meant to alarm you. It's meant to hand you clear, useful information so you can make better choices starting tonight. Because here's the honest truth, a small change in how you sleep may lower your risk of a serious overnight cardiovascular event, a stroke, a sudden blood pressure spike before dawn, or a drop in oxygen reaching your brain while you rest. These events don't only happen because of a missed pill or a bad meal. Sometimes they happen because of quiet, invisible strain we place on our bodies for a third of every single day while we sleep. Here's what a lot of people get wrong. They think sleep is passive, like the body just switches off. It doesn't. Your heart keeps beating. Your blood pressure keeps shifting. Blood keeps moving through vessels that in many people past 60 have already grown a bit narrower and stiffer than they were decades earlier. Your sleep posture influences circulation, breathing, blood pressure control, and even how efficiently your brain flushes out waste overnight. None of that is a small detail. It can be the line between waking up clear-headed and not waking up the way you hoped to. Today we're counting down 5 sleep-related habits that matter most for stroke risk after age 60. Some will be familiar. At least one is going to make you rethink something you've done your entire life without questioning it. I'm Dr. Emily Carter. I've spent close to 20 years working alongside cardiology and geriatric care teams before I shifted my focus toward public health education because I kept running into the same pattern, patients asking questions that should have been answered for them years earlier. So before we jump in, tell me in the comments, are you a back sleeper, a side sleeper, or a stomach sleeper? Has anyone ever told you that you snore, or that you seem to stop breathing for a few seconds at night? Your answer might help somebody else watching recognize a pattern in themselves. And if you're managing blood pressure, a heart condition, or you're on blood thinners, this one is especially for you. Let's get into it. Number 5. Flat back sleeping without any elevation. Let's start with something that feels harmless, sleeping flat on your back with a thin pillow or no elevation at all. Most people who sleep this way believe they're doing everything right. It feels neutral. It feels like the spine is supported evenly. And for plenty of younger, healthier people, it genuinely is fine. But here's what a lot of back sleepers over 60 don't realize. Lying completely flat, especially without any incline, sets off a chain reaction in your circulation and your breathing that can raise overnight stroke risk, and it has nothing to do with what you ate for dinner. When your body is fully horizontal, gravity behaves differently than it does when you're upright or even slightly propped up. In older adults, especially anyone with some degree of arterial stiffness, which becomes common with age, the heart has to push a little harder to keep blood moving upward toward the brain when there's no incline at all to help. There's a second issue. Lying flat lets the soft tissue at the back of your throat relax and sink backward. That narrows your airway. Even without a formal sleep apnea diagnosis, this can cause brief dips in airflow throughout the night, small drops in blood oxygen that force your body to respond by momentarily spiking blood pressure. Here's something worth remembering. Multiple studies in cardiology and sleep medicine point to the early morning hours, roughly 4 to 6 a.m., as the highest risk window for strokes and heart attacks. Part of the reason is a natural blood pressure surge that happens near the end of the sleep cycle. If those hours are spent lying flat with reduced airflow and rising pressure, the risk stacks on top of itself. The fix is far simpler than people expect. You don't need new furniture or medical equipment. Raising your head and upper body by roughly 20 to 30 degrees using a wedge pillow, stacking 2 firm pillows, or an adjustable bed frame changes things meaningfully. Blood returns to the heart more efficiently, the airway stays more open, and the strain on your cardiovascular system during those risky early morning hours goes down. If you're already on blood pressure medication or managing a heart condition, check with your doctor before changing your setup. But for most people, a gentle incline is safe, cheap, and something you could try tonight. Some notice within a week that mornings feel less foggy. Others are surprised at how much sharper they feel on the exact same number of sleep hours. Coming up, a position that feels completely relaxing, but maybe quietly putting pressure on an organ you don't want pressured. Number 4. Right side sleeping, and the extra load on your heart side sleeping is generally considered one of the safer sleep positions, and for the most part that's true. But there's a real difference between the left side and the right side, and for anyone past 60 with any cardiovascular concern, that difference matters. When you sleep on your right side, you're resting your body weight in a way that shifts the heart's natural orientation slightly. Since the heart sits a bit left of center in the chest, sleeping heavily on the right can increase the workload on the right side of the heart, the side responsible for pulling blood in from the body and pushing it toward the lungs. For a healthy 30-year-old, this barely registers. But for someone whose heart muscle is already working a little harder because of mild hypertension, some arterial stiffening, or reduced lung capacity, it adds one more layer of strain during hours the body is supposed to be recovering, not working overtime. There's also acid reflux to consider, which becomes far more common after 60 than most people expect. Right side sleeping tends to relax the valve that keeps stomach acid where it belongs. When reflux happens during sleep, it's not just uncomfortable, it activates your nervous system, raises your heart rate, and can trigger blood pressure spikes at the exact moment your body should be in its deepest, calmest state. Repeated night after night, year after year, that adds up to real cumulative strain on the cardiovascular system. Left side sleeping works differently. It reduces gravitational pressure on the heart's chambers, supports smoother gastric emptying, and lowers reflux risk. Some research even points to improved lymphatic drainage in this position, which is part of why doctors commonly recommend it during pregnancy, for very similar circulatory reasons. The same logic carries over meaningfully to older adults. If you've slept on your right side your entire life, nobody's asking for an overnight transformation. Try this instead. Place a firm pillow behind your back when you lie on your left side. It acts as a gentle barrier that keeps you from rolling onto your back during the night. Simple, low effort, and consistent small changes like this can become a new habit within a few weeks. One note, if you've had chest or lung surgery, or your doctor has already given you specific sleep guidance, always follow that first. This is general information. Your situation may be different. Number 3. Undiagnosed sleep apnea and its silent stroke risk. Quick favor before we continue, if this is useful so far, drop a 2 inches in the comments. It genuinely helps us understand who's watching, and we read every single comment. Now, number 3. This one might matter more than any position on this list, because it doesn't require changing how you move at night, it requires getting tested. Obstructive sleep apnea happens when the airway partially or fully collapses during sleep, causing brief pauses in breathing, sometimes dozens, even hundreds of times a night. Most people have absolutely no idea it's happening to them. They wake up tired, maybe with a headache. A partner might mention loud snoring, but the actual episodes happen while the person is unconscious, and without formal testing, they can go unnoticed for years. The cardiovascular toll of untreated sleep apnea in older adults is well documented. Every pause in breathing triggers a real spike in blood pressure, sometimes a severe one, as the body jolts itself into reopening the airway. Heart rate surges, oxygen levels drop. The body treats each event like a small emergency, releasing stress hormones into the bloodstream. Multiply that by dozens of episodes a night for years, and the cumulative damage to blood vessels, heart tissue, and stroke risk becomes serious. Here's the connection to position. Sleeping flat on your back dramatically increases how often these apnea events happen, because the tongue and soft palate fall backward more easily. That makes the first habit we covered even more risky for someone with even mild, undiagnosed apnea. If you snore, wake up exhausted despite a full night's sleep, have been told you stop breathing, or have unexplained blood pressure spikes, talk to your doctor about a sleep study. Many can now be done from home with a small portable device. A diagnosis opens the door to real treatment options: positional therapy, a CPAP machine, or for some people, a simple oral appliance. This is one area where catching the problem early can genuinely change your long-term health trajectory. Don't wait for a stroke to make the connection for you. Number 2. Stomach sleeping and neck rotation that restricts blood flow. We're almost at number 1, and if you've made it this far, you're already more informed than most people will ever be on this topic. What's coming up tends to genuinely change habits once people understand the mechanics behind it. Sleeping face down, with your head turned to one side for hours, is considered by many cardiologists and neurologists to be the most physically disruptive sleep position for adults over 60. And it's not just one issue, several problems stack together. First, spinal alignment. Stomach sleeping forces an unnatural curve into the lower back while straining the neck at the same time. To breathe while lying face down, most people rotate their head to one side, often the same side every single night for hours. That sustained rotation compresses the vertebral arteries, the paired blood vessels running through the neck bones that supply a significant portion of the brainstem and the back of the brain. Even mild, chronic compression of these arteries reduces blood flow to regions responsible for balance and coordination. Younger people with flexible, healthy arteries usually tolerate this fine, but past 60, when arteries are less elastic, when arthritis in the neck may have already narrowed the space these vessels pass through, the same nightly head rotation becomes a genuine risk factor. Second, stomach sleeping makes deep, full breathing much harder. Your chest is pressed into the mattress, limiting expansion. Your lungs can't fill completely. Blood oxygen can drop subtly but consistently through the night. Third, for anyone managing high blood pressure, that same neck rotation adds strain to the carotid arteries, the vessels supplying the front and sides of the brain, which happen to be the regions most commonly affected in ischemic strokes. If you've been a lifelong stomach sleeper and switching feels impossible, start small. Place a body pillow beside you and let yourself lean into it on one side instead of lying fully flat on your stomach. Many people find that within 2 to 3 weeks, side sleeping starts to feel completely natural. The body adapts more easily than we usually give it credit for, and for this particular change, the payoff in reduced stroke risk is meaningful. Number 1. Left side sleeping with a gentle incline. We've arrived at the single most important factor on this list, and if you've stayed with us this far, type 4 inches in the comments. It tells us you're genuinely engaged, and it helps us keep making content worth your time. This position is number 1, not just because it's protective on its own, it's because it addresses nearly every risk factor we've discussed, all at once. Here's what happens when you sleep on your left side with your upper body gently raised by about 15 to 20 degrees. Your heart rests in its natural position, with no body weight compressing it and no awkward gravitational pull forcing it to work against its own shape. The right side of the heart, which receives returning blood from the body, drains more efficiently. The left side, which pumps oxygenated blood out to the body and brain, works with less resistance. Multiple studies involving patients with heart failure and hypertension have shown better cardiovascular readings in this position compared to lying on the back or right side. The slight incline also helps keep the airway open because the tongue rests forward instead of falling backward into the throat. That means fewer apnea events and steadier oxygen levels through the night. And remember that dangerous early morning window we talked about, when blood pressure naturally surges? The body enters that window already better oxygenated and with lower baseline pressure, which makes it noticeably less dangerous. There's one more benefit getting real attention lately. Research on the brain's glymphatic system, the network responsible for clearing metabolic waste from brain tissue during deep sleep, suggests left-side sleeping may improve how efficiently this clearance happens. This system is most active during deep, slow-wave sleep, and its efficiency matters not just for stroke prevention but for long-term brain health in general. The research is still developing, but early findings are consistent enough that many sleep specialists now specifically recommend this position for older adults managing heart or cognitive risk factors. If you're on blood thinners, have a pacemaker, or have had recent heart surgery, always check with your care team before changing your sleep setup. But for most people over 60, this is one of the most accessible, zero-cost, evidence-backed changes you can make tonight to lower your overnight stroke risk. You don't need a prescription, just a decent pillow, and the knowledge you now have. Let's bring it all together. We covered 5 things that shape your overnight stroke risk, starting with how flat you lie, moving through the real difference between left and right side sleeping, the hidden danger of undiagnosed sleep apnea, the way stomach sleeping strains the arteries in your neck, and finally, the one position that ties all of it together. The takeaway isn't that sleep is dangerous. Sleep is one of the most powerful tools your body has for healing and recovery. The takeaway is that how you sleep matters. And at 60, 70, or 80, your body deserves a little more intentional care during those night hours than it needed at 30. So start small tonight. Try a wedge pillow or an extra cushion under your upper body before you close your eyes. If you normally sleep on your right, consciously start the night on your left instead. If anyone's ever told you that you snore heavily or stop breathing at night, bring it up at your next doctor's visit. None of this requires a dramatic overhaul. These are quiet, practical adjustments, the kind that add up over time. And if you have a spouse or partner, share this with them. Sleep health is often something you can improve together by simply noticing each other's patterns and encouraging small changes. We don't get to control every risk factor that comes with getting older, but this is one you can start working on tonight, and that's worth something. Thanks for spending this time with me. Take care of yourself, and I'll see you in the next one.